The following segment discusses chin augmentation.
Although the shape and prominence of the chin is important on the front view of the face, it is even more important part of one's profile. Some people feel their chin is not as strong as they would like, and it does not contribute a sense of balance to their face. Augmentation of the chin can be appropriately and easily accomplished with placement of a chin implant in those patients who feel they have a small chin. This is a before and after profile view of a patient who has had chin augmentation performed, as well as just a slight modification of her nasal tip. The nose and the chin are the two most important features on our profile or side view. A small chin will magnify the size and appearance of the nose, especially if it is large and over-projecting. It is desirable to have a sense of facial balance with the nose and chin in harmony. Here is another before and after photograph of a patient who has had a chin implant placed. Again, it creates more balance for facial features and can improve one's appearance dramatically while looking very natural. These are before and after pictures of a patient who had a rhinoplasty and a very small chin implant placed. This photo is shown to again give you an idea of how important the chin and the nose are to one's profile. Even a small implant can provide better balance. If your surgeon offers computer imaging, you may want to explore these possibilities with her or him. Combined liposuction under the chin can additionally improve the contour of the chin if needed. These are before and after pictures of a patient who had a rhinoplasty, chin augmentation, and liposuction under the chin performed. The after pictures were taken 2 weeks and 16 months after her surgery to give you an idea of the appearance of that time during healing. Again, dramatic improvement in facial balance can be obtained. These are before and after photos of a patient who felt preoperatively that he had a very weak chin even after a small implant was in place. Most of this illusion of a weak chin is created from the excess fat and unfavorable angles in this patient's neck. Although a large chin implant was placed, most of his improvement was from the open contouring of fat and muscle in his neck. Other surgeons may utilize different techniques. These pictures are important because many patients come in with anatomy similar to this, feeling they have a weak chin and only a chin implant is needed. Ideally, however, the anatomy below the chin should also be addressed. This patient also had a brow lift, blepharoplasty, and rhinoplasty performed.
There are other alternatives for enhancing the dimensions of the chin, which will be discussed. However, silicone prefabricated implants are very commonly used. Synthetic or alloplastic implants are made of different materials and come in many different styles, shapes, and sizes. Some of these are shown in this photo. The selection of style, size, and shape is best determined by your unique anatomic needs and desires. Your surgeon should be able to provide options and discuss these different implants with you. Implants can be placed on your chin either through an incision inside your mouth under the lower lip or through an external incision underneath your chin. The procedure can be performed safely through either approach, but your surgeon will likely have a preference. Ultimately, the chin implant is positioned along the chin area as shown in these photos. Not all implants are this long, as some only provide increased volume at the tip of your chin. There are certainly other alternatives to augmenting your chin other than placement of alloplastic or synthetic implants. Bone grafts can be taken from other bones in your body and placed along your chin. The bone on your chin can also be cut and modified and moved forward or backwards to achieve the amount of projection desired. This is called an osteotomy. Both these options should be discussed with your surgeon. These options are often more complicated. Bone grafting may involve possible complications at the donor site where the graft was obtained, and the grafting process is variably successful. Osteotomies, or repositioning of your own chin, usually requires screws and permanent hardware to reposition the bone. Often there is also notching or contour irregularities where the bone was cut, which one can feel and see. Some surgeons may recommend injection of fat or other materials to augment the chin. Synthetic or alloplastic implants often appear to be a simpler, more reasonable alternative. One important consideration before thinking about a chin augmentation is your occlusion or bite. If your teeth do not fit together correctly or comfortably when biting down, you probably have malocclusion. A chin implant will not correct this problem. If you do have malocclusion, you should discuss the degree and treatment with your surgeon and dentist first. In these cases where the patient would like to correct their occlusion, Dr. Fisher usually advises delaying the possible placement of the implant. Usually, an orthodontist is needed, among other team members, to improve the bite pattern or occlusion. Sometimes the jawbone or mandible will need to be modified or moved with an osteotomy as previously mentioned. After correction, an implant may not be needed at all.